12-year-old boy, mark the age, presents to the pediatrician for evaluation, non-specific, dull pain in his extremities. Remember extremities. Non-specific and dull pain in extremities for last few months. Also, he has become easily overwhelmed and does not sweat. This means hypohidrosis. Okay, this is hypohidrosis. His development is normal. He has no behavioral problems. So developmental history is normal. No behavioral problem. Cloudy corneas. So eye has problem here. Simple, small, red, raised papules. So many papules are there around umbilicus and on the thigh. So you can see here, hypohidrosis, this small red raised papules, these are nothing but angiokeratoma. These are angiokeratomas. And then there are three presentations. You can see, we have seen hypohidrosis, you can see angiokeratoma, and then you see burning pain, peripheral neuropathy, burning pain here. So this is peripheral neuropathy, burning pain at the extremity. This is peripheral neuropathy. So peripheral neuropathy. So you can see here, hypohidrosis. You can remember this as mnemonics also. F-A-B-R-Y. F-A-B means F for hypohidrosis, febrile episode, angiokeratosis, A for, and then B for burning pain, and then R for kidney failure, renal failure, and then U, death by this patient reach the young age, patient dies. Patient cannot survive beyond young age. This is the mnemonics you can remember from this Fabry. Febrile episodes means hypohidrosis, angiokeratoma, burning pain means peripheral neuropathy, renal failure, and death by 20s. Okay, it does not go beyond, the patient does not go beyond 20. So you can see what is angiokeratoma. Angiokeratoma is nothing but deposition of, this is Fabry disease. So fiber, I told you, remember this has fiber. Globotriaoside has fiber. This deposit of this lipid, Fabry disease lipid, globotriaoside in the endothelium, dermal endothelial cell, that will cause vessel to bulge. This is vessel, this will cause vessel to bulge, and that bulging will be seen as angiokeratomas, like this. If you see more clearly, this is, if you can see in scale, it is very small papules, means more than 1 millimeter. So these are papules, less than 1 millimeter. You can see here, small papules. These are called angiokeratoma. The keratoma because of bulging of art vessels. So this is because of deposition of this globotriaoside. And main cutaneous, this is the main cutaneous lesion of Fabry disease, and can be the earliest physical sign of this disease, and found in 80% of both male and female. Because this is the only X-linked disease. See, this is the only X-linked recessive disorder. In all sphingolipidosis, Fabry is the X-linked recessive. This is a very important thing. X-linked recessive. All other are autosomal recessive. This is the X-linked recessive. So this disorder will be seen more in male than female. Though even if it is seen in female also have, 80% of the female also will have this angiokeratoma. That is why angiokeratoma is very important presentation. Along with angiokeratoma, you can remember Fab. One is hypohidrosis, means febrile episode. A, angiokeratoma, and B for burning pain. So you can see along with this pre-presentation, so renal failure, you can see renal failure because of this angiokeratosis. This you can see the angiokeratosis, there will be blockade in the vessel, and thus blockade in small vessel will cause heart problem, cardiovascular problem. It can cause even problem in brain, in kidney. And you can see eye changes, clouding of cornea. Where else did you see the clouding of cornea? We have seen clouding of cornea in Hurler syndrome. Don't forget it, Hurler syndrome. So here also you will see clouding of cornea in Fabry. Fabry disease, which is X-linked recessive, you will see clouding. These are angiokeratomas. And these are, you can see that these are the biopsy section of renal glomerulus. You can see this is glomerulus. In that glomerulus, you can see lipid are deposited here. Lipid are deposited. So this is glomerulus. You can see lipid is deposited. Which lipid? GB3. Globotriocyte. Globotriocyte. Remember. So this is globotriocyte. This is globotriocyte that is deposited. Why it is deposited? Because there is one enzyme deficiency. The enzyme that breaks this bond is absent. Okay. What is galactosidase? Alpha galactosidase. This is Fabry disease, alpha galactosidase. Because alpha bond is there, so this bond will not be broken because this is absent. That is why this disease will happen. So how do you remember? So this is a very simple. This is, remember this disease like burning fiber. I told you this burning fiber burns belly, thigh, eyes, hands like this. So you can remember this like this fiber is this. So this fiber is burning everything. Your hand, the patient's hand, eyes, kidney, so damaging everything. So you can remember that way, you can associate, remember this burning fiber, you can remember the presentation in this patient.